Does your bearded dragon have brown teeth? If so, this is the video for you. We'll find out what causes this and how to treat it. Hi, I'm Dr. Pat with Little Critters, and on this channel we show all things related to pet care in the hopes that we can help your pets. So this little girl has pretty severe periodontal disease, and we're going to show you her teeth. She does tend to be a little bit of a biter, so this could be interesting. But let's see here if she'll let us take a little look. Hold on, I know, little girl. All right. Hold on, little girl. Hold on. You're stubborn, Beardy. No bite. All right, so when you look at her teeth, you can see all of the brown calculus along her teeth. You can also see pus below the gum line. And this is bilateral, so we're seeing this on both sides. It's very severe periodontal disease. So periodontal disease in bearded dragons is a very common problem that we see. And the issue is that often it can go down and infect the bone, and we get osteomyelitis or a mandibular bone infection, which is much more serious than just a periodontal disease. So you do need to take a look at your beardy's teeth, make sure they're not brown, that you don't have a bunch of yellow calculus and debris going down to the bone, because this is something that should be taken care of. So what we do with these bearded dragons is a dental cleaning, much like your dog or cat would have done. They are under general anesthesia. There is a breathing tube put in, and then we remove all this calculus and debris. Many of these are also put on antibiotics because they already have pre-existing infection from this. And again, we worry about osteomyelitis. And today we're doing a dental cleaning on a bearded dragon lizard. Here we're showing the placement of an IV catheter in the ventral tail vein. The tricky part here is stabilizing the catheter as it does protrude out at a slight angle, but our experienced veterinary nurses are able to handle this proficiently. He has been given IV propofol through this catheter and gas anesthesia. He is being monitored with a Doppler ultrasonic probe as well as a Cardell, which is being shown here. We do place them on a warming blanket and put their head in a downward drainage position. An endotracheal tube is being put into his airway to protect the airway from the fluids that are liberated at the dental. And we just stabilize that with a mouth gag across the tube and tape this to his head to stabilize the apparatus. It makes it a little bit harder to work around, but we feel like it's a very safe method for protecting the tube and his airway during the procedure. It's all hands on deck during a lizard dental cleaning. As you can see, we actually physically hold and stabilize the tube throughout the entire procedure, and then hand scale and remove all of the periodontal, the tartar, and the pus causing the periodontal disease. And here you can see, because of the acrodont teeth of bearded dragons, these teeth are set directly in bone, and the periodontal disease extends up to the overlying or underlying bone, where we have purulent debris or pus that has to be hand scaled and physically removed. An ultrasonic scaling alone will not remove this debris, although after hand scaling we do follow up with the ultrasonic scaling as well. Here we're showing you mandibular arcade as they hand scale and clean that, and this has already been partially cleaned at this point in the video. He is under general anesthesia still, and again his head is at somewhat of a dependent drainage angle. In spite of the fact that he has a breathing tube in, we still try to make sure that all the fluids are running to the outside of the mouth just to ensure additional safety. One nurse does nothing but monitor their vitals throughout this anesthetic procedure, and another nurse does nothing but monitor anesthetic depth and tube placement. Generally, we have 3 nurses and a doctor working on these animals during their procedure. And here you can see that the arcade is cleaning up beautifully. Instead of the thick yellow pus, we now have clean bone and teeth.